Today, we're talking about Cytra-2. Cytra-2 is used to make the urine less acidic, which can help the kidneys get rid of uric acid and prevent gout and certain types of kidney stones. It can also prevent and treat certain metabolic problems caused by kidney disease. Cytra-2 contains citric acid and citrate salts, which belong to a class of drugs known as urinary alkalinizers. Your doctor may choose this medication based on how much potassium and sodium you can take, as some conditions require you to limit your intake of these minerals. The daily dosage and the best time to take Cytra-2 will be determined by your doctor based on your specific condition and needs. Before taking Cytra-2, make sure to shake the container well. Take this medication by mouth as directed by your doctor, usually 4 times a day. To help prevent diarrhea and stomach upset, take each dose after a meal, and mix your prescribed dose of medication in a full glass of cold water or juice just before taking, or take as directed by your doctor. Drink the entire mixture slowly. The liquid form of this medication must be mixed with at least 4 ounces of water or juice before taking. Refrigerating the mixture before drinking may improve the taste. Drink more water or juice after taking this medication unless otherwise directed by your doctor. Dosage is based on your medical condition and response to treatment. Take this medication as prescribed. Do not increase your dose or take this more often without your doctor's approval. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. While taking this medication, you may need to test the pH, acidity, of your urine using special paper. The pH will help determine the proper dose. Consult your doctor or pharmacist for more information. If you are experiencing nausea, vomiting, diarrhea, or stomach pain while taking Cytra-2, try mixing the medication with water or juice, taking it after meals, and drinking more fluids to prevent these side effects. It's essential to remember that this medication has been prescribed because your doctor has determined that the benefits to you outweigh the risk of side effects. Most people using this medication do not experience serious side effects. However, if you notice swelling of the hands/ankles/feet, tingling/numbness of the hands/feet, weakness, fast/slow/irregular heartbeat, mental/mood changes, muscle spasms, or seizures, contact your doctor right away. Although a severe allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed above, contact your doctor or pharmacist. Before taking Cytra-2, make sure to let your doctor or pharmacist know if you have any allergies or if you are allergic to any of the ingredients in the product. It's important to discuss any medical history, particularly if you are on a sodium-restricted diet, have imbalances in minerals, or have conditions such as high blood pressure, heart problems, or kidney disease. If you are using the liquid form of Cytra-2, be aware that it may contain sugar, so consult with your doctor or pharmacist if you have diabetes. Additionally, if you are on a salt-restricted diet, inform your doctor because Cytra-2 contains salt, sodium. For pregnant women, Cytra-2 should only be used if necessary and under the guidance of a doctor, as it may worsen high blood pressure during pregnancy. It's also important to consult with your doctor before using Cytra-2 if you are breastfeeding, as it is unknown if the drug passes into breast milk. It's important to be aware of potential interactions with other medications while using Cytra-2. This includes antacids containing aluminum, aspirin, lithium, and quinidine. If you are taking low-dose aspirin for heart attack or stroke prevention, it's typically recommended to continue unless otherwise directed by your doctor. Be sure to consult your doctor or pharmacist for specific details. As always, it's essential to keep a list of all the medications and products you use and share it with your healthcare providers to ensure safe and effective use of Cytra-2. If someone has taken too much Cytra-2 and has serious symptoms like passing out or trouble breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. If you're in Canada, you can call a provincial poison control center. Symptoms of an overdose may include muscle spasms and seizures. It's important to get help right away in these situations. It's important not to share your Cytra-2 medication with others. Your doctor may also recommend lab or medical tests, such as checking your sodium levels, while you are taking this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Remember to follow your doctor's instructions carefully. If you forget to take a dose of Cytra-2, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take double the dose to make up for the missed one. When storing Cytra-2, make sure to keep it at room temperature and away from heat, light, and moisture. It's important not to freeze it or store it in the bathroom. And remember to always keep all medications out of reach of children and pets. When it comes to disposing of Cytra-2, be sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.